In the United States, 23% of all adults, or more than 50 million people, have arthritis. Arthritis is the most common cause of disability in the United States. More than 20 million individuals with arthritis have severe limitations in function on a daily basis. Each year, arthritis results in nearly 1 million hospitalizations and close to 45 million outpatient visits to healthcare centers. 60% of U.S. adults with arthritis are of working age, 18 to 64 years. Arthritis affects people of all ages, including children. The most common form of arthritis is osteoarthritis. Arthritis is an inflammation of the joints that can cause debilitating joint pain. There are more than 100 different kinds of arthritis and related conditions. Arthritis affects more than 50 million adults and 300,000 children in America, according to the Arthritis Foundation. The causes and treatment options available vary from one type of arthritis to another. To find the best treatment and management strategies, it's important to determine the type of arthritis you have. Most common types of arthritis. Osteoarthritis, OA, affects about 30 million Americans. Osteoarthritis, OA, also called degenerative arthritis, is the most common form of arthritis in the U.S. OA is often referred to as wear and tear arthritis or degenerative joint disease. Osteoarthritis patients are mostly affected in the hands, hips and knees, experiencing pain, aching, stiffness, decreased range of motion and swelling. With OA, cartilage in your joints breaks down, eventually causing your bones to rub together and your joints to be inflamed with subsequent pain, bone injury, and even bone spur formation. It may occur in just one or two joints on one side of the body. Age, obesity, injuries, family history, and joint overuse can raise your risk of developing it. Common symptoms include joint soreness, morning stiffness, lack of coordination, increasing disability. To learn if you have OA, your doctor will take your medical history and conduct a physical exam. They may order X-rays and other imaging tests. They may also aspirate an affected joint, taking a sample of fluid from inside to check for infection. Rheumatoid arthritis affects an estimated 1.5 million Americans. Nearly 3 times as many women have RA than men. Rheumatoid arthritis, RA, is an autoimmune and inflammatory disease. Patients with RA have an immune system that attacks healthy cells in their body by mistake. RA commonly affects many joints in the hands, wrists, and knees, but can attack any joint in the body. Common symptoms of RA include morning stiffness and joint pain, typically in the same joint on both sides of your body. Joint deformities can eventually develop. Additional symptoms may also develop in other parts of your body, including the heart, lungs, eyes, or skin. Sjogren's syndrome frequently occurs with RA. This condition causes severely dry eyes and mouth. Other symptoms and complications include sleep difficulties, rheumatoid nodules under the skin and near joints, such as the elbow, that are firm to the touch and consist of inflamed cells. Numbness, warmth, burning, and tingling in your hands and feet. Your doctor can't use any single test to determine if you have RA. To develop a diagnosis, they'll likely take a medical history, conduct a physical exam, and order X-rays or other imaging tests. Your doctor may also order a rheumatoid factor test, anti-cyclic citrullonated peptide test, complete blood count, C-reactive protein test, erythrocyte sedimentation rate. These tests can help your doctor learn if you have an autoimmune reaction and systemic inflammation. Juvenile arthritis, UA, affects nearly 300,000 American kids. Arthritis in children is known as juvenile arthritis, UA. UA is an umbrella term for several types of arthritis that affect children. The most common type is juvenile idiopathic arthritis, JA, formerly known as juvenile rheumatoid arthritis. This is a group of autoimmune disorders that can impact children's joints. JA starts to occur in children younger than 16 years old. It can cause muscle and soft tissue to tighten, bones to erode, growth patterns to change, joints to misalign. Months of aching joints, swelling, stiffness, fatigue, and fevers may indicate juvenile idiopathic arthritis. Other less common forms of UA include juvenile dermatomyositis, juvenile lupus, juvenile scleroderma, Kawasaki disease, mixed connective tissue disease. Ankylosing spondylitis affects an estimated over 1 million Americans. Ankylosing spondylitis, AS, is an inflammatory condition that, if left untreated, can result in the fusing of some of the vertebrae in your spine. When your vertebrae fuse, your spine is less flexible, leading to pain, inflammation, reduced posture, difficulty breathing, and a reduced quality of life. Ankylosing spondylitis, AS, and other types are autoimmune conditions that can attack the locations where tendons and ligaments attach to your bone. Affecting more men more than women, ankylosing spondylitis often shows up in early adulthood. While it mostly affects the spine, inflammation can be experienced in other areas of your body, most notably in your eyes. Ankylosing spondylitis is hereditary. Most people who develop AS have the HLA-B27 gene. You're more likely to have this gene if you have AS and you're Caucasian. It's also more common in men than women. Other spondyloarthritic diseases are also associated with the HLA-B27 gene, including reactive arthritis, formerly known as Reiter's syndrome, psoriatic arthritis. Enteropathic arthropathy, associated with the gastrointestinal tract, acute anterior uveitis. Juvenile ankylosing spondylitis, lupus erythematosus, affects an estimated 1.5 million Americans. Lupus is an autoimmune disease that attacks patients' own tissues, producing widespread inflammation. The cause of lupus is unknown. The most common form of lupus is systemic lupus erythematosus, SLE, which can affect the joints, skin, brain, lungs, kidneys, and blood vessels. Systemic lupus erythematosus, SLE, is another autoimmune disease that can affect your joints and many types of connective tissue in your body. It can also damage other organs, such as your skin, lungs, kidneys, heart, brain. SLE is more common among women, particularly those with African or Asian ancestry. Common symptoms include joint pain and swelling. Other symptoms include chest pain, fatigue, fever, uneasiness, hair loss, mouth sores, facial skin rash, sensitivity to sunlight, swollen lymph nodes. You may experience more severe effects as the disease progresses. SLE affects people differently, but starting treatment to try to get it under control as soon as possible and working with your doctor can help you manage this condition. Gout affects an estimated 8.3 million Americans. Gout is a very common form of arthritis. Gout is most common in men and obese adults. Age, diet, alcohol use, and family history can affect your risk of developing gout. If left untreated, repeated bouts of gout can lead to gouty arthritis. Gout can be incredibly painful. A joint at the base of your big toe is most likely to be affected, although it can potentially affect other joints. You may experience redness, swelling, and intense pain in your toes, feet, ankles, knees, hands, wrists. An acute attack of gout can come on strong within a few hours during the course of a day, but the pain can linger for days to weeks. Gout can become more severe over time. Psoriatic arthritis affects an estimated 2.25 million Americans. Psoriatic arthritis, PSA, is an autoimmune disease. The body's own immune system becomes overactive and attacks normal tissues in the body. Patients with PSA can experience swelling, stiffness, and pain in their joints and surrounding tissues, as well as nail changes and extreme fatigue. According to the National Psoriasis Foundation, NPF, up to 30% of people with psoriasis will develop psoriatic arthritis. That means that PSA, which is an inflammatory form of arthritis, affects an estimated 2.25 million Americans. People with psoriatic arthritis experience the red patches of skin and silvery scales that psoriasis patients experience, as well as the joint pain and stiffness associated with autoimmune forms of arthritis. PSA can affect any part of your body, including your fingertips and spine, and the disease severity may range from relatively mild to severe. For patients with psoriatic arthritis, disease flare-ups are relatively unpredictable as they often alternate with periods of remission. If PSA symptoms start to set in, you'll want to see your doctor to treat this as early as you can. Fibromyalgia, estimated to affect as many as 5 million Americans. Fibromyalgia is a condition that causes widespread pain throughout the body. Fibromyalgia can also cause sleep problems, fatigue, and mental or emotional distress. Patients with fibromyalgia are often more sensitive to pain than those who do not have fibromyalgia. This is referred to as abnormal pain perception processing. Fibromyalgia affects about 2% of the U.S. adult population, which is roughly 5 million U.S. adults. The cause of fibromyalgia has not yet been found, but, thanks to research, there are effective treatments that can help you keep it managed. Methods for the diagnosis of arthritis. Each arthritis has different clinical and laboratory diagnostic criteria. Diagnosis of arthritis include physical examination. Ask about symptoms and perform an examination to determine joint range of motion, joint deformity, and some tests to identify joint effusion. Tests that need to be done. Basic tests. Peripheral blood cells, erythrocyte sedimentation rate, C-reactive protein, CRP, liver and kidney function tests, chest X-ray, electrocardiogram. X-ray of joints. Detect changes in the structure of joints. Bone scintigraphy. This is a modern method that not only shows changes in the shape of bones and joints, but also detects metabolic disorders. Especially helps in early detection of cancer cases and osteosarcoma. The method has been widely applied in the world and gives high results. Other immunological tests in case of rheumatoid arthritis such as quantitative rheumatoid factor, Rh, anti-CCP. Treatments for arthritis. With the exception of infectious arthritis, most arthritis diseases are considered chronic diseases. Therefore, definitive treatment of arthritis is almost always very difficult. Although there are many causes of arthritis, the overall goals of treatment are to relieve pain, restore joint activity, limit recurrence, and prevent joint deformity. Methods for treating arthritis include medical treatment. Applicable to most cases, it can be only medical treatment with drugs alone or in combination with surgical methods. Medications are used depending on the type of arthritis, including anti-inflammatory pain relievers and specific drugs for each cause. Therefore, the use of the drug should be carried out according to the prescription of the doctor. The anti-inflammatory pain relievers commonly used to treat arthritis are non-steroidal anti-inflammatory drugs, NSAIDs, with brand names such as Mobic, ibuprofen. Corticosteroids can be used as an anti-inflammatory in some cases. Surgical treatment. Surgery is only indicated in the following cases: joint cannot function. Persistent pain unresponsive to medical treatment greatly affect the patient's life and aesthetics. Surgical methods include arthroplasty to replace the joint. Arthroplasty. The ends of the bones are locked together until they heal. Bone reshaping. Bone will be reconstructed surgically to ensure proper functioning of the joint. Reasonable lifestyle. Besides the treatment methods, a reasonable lifestyle is also essential for arthritis patients. Exercise and diet are two issues that need attention. Regular and gentle exercise will help keep joints more flexible. Swimming is a good choice for arthritis patients because this sport will reduce pressure on the joints. However, you need to make sure that you have a moderate exercise regimen. The diet should reduce the amount of starch, especially in cases of obesity. Increase foods that contain antioxidants to reduce inflammation. Maintain a diet full of nutrients to reduce the progression of arthritis. Summary. An accurate and early diagnosis can help prevent irreversible joint damage or disability. Treatment for arthritis depends on the specific cause of the arthritis, its severity, and how much it interferes with daily activities. Age and occupation are also aspects that need to be considered so that the doctor can come up with an appropriate treatment plan. If you have any of the signs or symptoms associated with osteoarthritis, see your doctor for early detection and treatment.